payday terms first. Here we are. Okay, capillary. We already talked about this. A lot of these are actually repeat from kind of our vocabulary from the PowerPoint last week. So capillary says tiny blood vessel where gas exchange occurs. What is that talking about, gas exchange?
Where the oxygen.
Right. Where oxygen leaves the bloodstream, remember, enters into the tissues, and then what leaves the tissues? Carbon dioxide to go back in the bloodstream to take back to the. So murmurs. Murmurs are just an abnormal heart sound, so it could mean lots of things. Let's look, actually, we'll look at some murmurs on here for a minute. So here's a regular heart sound. All right, this is just a normal heart sound. Okay, the left up sound. So it's two sounds. They're pretty straightforward. You'll hear some differences in a minute. So the sounds that you actually hear with the stethoscope when you're listening to someone's heart are made by the valves closing. That's what makes that noise. So the valves close and blood rushes back up against it. Right? That's what makes that noise. So you got the AV valves close at one point, and then the lunar valves like the pulmonary and the aortic valves, those close together. So those are the two sounds that you hear. Here's a children's heart rate. Notice how much faster it is. So much faster. And babies, look, here's got the things. Infants, 100 to 160 beats per minute. That's the norm. For babies, yeah. It says children 1 to 10 years, 70 to 120. Children over 10, 60 to 100. And then adults is generally, I would say 60 to 90. So that's a normal heart sound. Let's listen to some abnormal ones. So stenosis is like a narrowing, or it just doesn't work as well. So you can see normally the aortic valve would look like this, and then here you can see like it's got some parts that have kind of shut over time. Let's do the advanced one. Here it makes a big whooshing sound. That's what you're hearing. Before it was just like a pretty steady click. Well, it's two of them. You only hear that one click, and then you hear a.
Is that actually they like listen to someone's heart
and recorded it?
Isn't that person dying?
Do what? No. But they probably needed some kind of
treatment.
Yeah. Sclerosis, which means hardening. So aortic hardening, basically. It's not going to open and close like it should. Do it. Yeah. That's because a lot of these you'll hear, there's some that are moving. Some of it's moving constantly. Like there should be a time when there's no movement. That's an obstruction, left ventricle obstruction, which I'm not even sure what would cause. That says cause patients with Williams syndrome. So that whooshing noise, that's what you're listening for a lot of times with the murmur, is that it just doesn't have a good aortic insufficiency. So look, it's not closing all the way. It stays open. Yeah, you hear that? Okay, that's not normal.
Looks like there's like an alarm in the background.
And then this is a prosthetic aortic valve. So think a mechanical valve. So this is a valve that they've actually made and replaced their aortic valve with, like a machine. So anyways, now they can also use, sometimes, I mean, you can use like pig valves and they can replace them with live tissue too. But they can use mechanical ones. So those are aortic issues. Pulmonic issues. So this is pulmonic stenosis, so narrowing of the pulmonic valve. Wishing after it. Just not a crisp, clear sound like that first one. Okay, here's an atrial septal defect. And septum, what's the septum? You want to talk about that, didn't it? Septum is the wall between like the right and left sides of the heart. The wall, right in the middle. So an atrial septal defect means that there's a hole or an opening between the two atria on the right and left sides. Why would that be an issue?
Because you're rich in blood.
Right. The right side of your heart holds deoxygenated blood, where the left side holds oxygenated blood. So they're getting mixed around in there. Still had the two beats, but you can hear that's extra noise.
It's like a car like running over.
Okay, pulmonic regurgitation. So regurgitation just means it's going back up. If you were to regurgitate your food, that's coming back up. Yes, all these are abnormal. Okay, so see how it's open? So you think about pressure. So you think about your heart, right? As it beats, you get pressure on the atria that push blood into the ventricles. Then the pressure comes down to the ventricles that pushes blood back out of those pulmonary artery and your aortic artery. Remember how those crisscross in the front? You had your hearts, you were holding them. You were holding your heart.
Oh, yeah.
So you think that's how it's going to work. So if it's regurgitating, then the pulmonic valve is not closing all the way, and some of that blood is going back down. This is just innocent murmurs. It's just sometimes kids have murmurs, pregnancy. Just hear that extra little bit of noise in there. Almost like a third noise, like kind of a galloping kind of sound. Pregnancy is normal because when you're pregnant, you have about double the amount of blood going through your system. So it's just extra blood. Oh, it's kind of harder to hear. You can hear it, but it's harder to hear. And then this one, okay, a PDA, patent ductus arteriosus, not public display of affection, is another opening, kind of like we talked about with the septal defect. The difference is that, okay, a PDA occurs between the pulmonary artery and the aorta. So there's actually a hole between those two where they cross over, an opening between the two. Now, if this is normal, that is a normal finding in babies that are still in the womb. Why do you think that is? Because what? It's not developed. What else? Why would there be a hole right there, you think?
So blood can flow from you to
Well, the umbilical cord, as veins and arteries said, do that.
And then with oxygen,
Say it again.
like oxygen and
Right. Their blood doesn't have to go to their lungs to get oxygen, right? Your blood does. Well, babies don't get oxygen from their lungs. They get it from the mom's blood. That is, the umbilical cord actually is shunted in to like the vena cava. So it goes up to the heart. So what happens is, since their opening is between those two vessels, it mixes the blood so that it bypasses the lungs, basically. So the oxygenated blood doesn't go to the lungs and just get a little, I mean, it's going to lose oxygen if it goes that route. So some of that new oxygenated blood goes on to the aorta to be circulated. That make sense? That way it doesn't, now some of it still goes to the lungs, but it doesn't have to go there to pick up oxygen. So that's a normal finding in probably premature babies. A lot of times it closes up on its own. But it can stay, it doesn't always close up. Here's the old wishing, sounds like when we wish. All right, tricuspid stenosis, so again, narrowing. That doesn't sound too horrible on here compared to the normal, but you can still hear that. Regurgitation. You can really hear the regurgitation because that's blood pulling back through when it's not supposed to. That's why those are so much louder. And then a VSD is a ventricular septal defect. So again, with the hole or opening, but it's between the two ventricles this time instead of the two atria, like we talked about. So sometimes babies are born with this as well. A lot of times it will close up on its own, but it may not. And then last one, mitral stenosis. Let's do regurgitation. Here, let's do the severe one. That's lots of extra blood going through. That shouldn't be there. And then mitral valve prolapse. You may have known somebody who has this. It's not all that uncommon. What does it say? 2 to 6% of the population. A lot of people have it and it's just gone undiagnosed. I think this is what Coach Dowers had. He had surgery a couple years ago. And they repaired this. Still. So that's a murmur though. It's just an abnormal heart sound. So it's, you know, it's not all that hard a lot of times to hear a murmur, but it's hard to tell what it is. Like I could not listen to someone's heart and tell you which one of those things it was by any means. I would be happy if I could tell you it was abnormal, you know, that had a murmur. But that is, you know, cardiologists, it's crazy to think about. They just listen to your heart. And they, a lot of times they can tell what it is just by the way it sounds and the location of that sound. So you listen in different areas to determine, you know, different issues. Pretty cool. So that's a murmur. That thing drives me crazy. Aorta is the root word for aorta. Makes sense. Arterios, artery. A lot of these we've had before. Vasos, vessel. So it could be either one. Veno is vein. Phlebo is vein, like a phlebotomist. Y'all heard of a phlebotomist? It's like somebody who draws blood. They work in a lab or something. They draw blood. Like people who work at Carter's Blood Care. Take your blood for blood donation. They're a phlebotomist. They actually have classes, like PJC has a phlebotomy class or a phlebotomy program. Vasculo is vessel. And then arrhythmia or dysrhythmia means abnormal heart rhythm. So what word do you hear there? Arrhythmia. Rhythm for sure. A means what? Without or not. So without rhythm is what that means. Condition without rhythm. So your heart doesn't have a rhythm. Or dysrhythmia would mean do what? I know what it means. We talked about it when we talked about dyspnea or dys means bad or like labor. Like in dyspnea, it's labored breathing or painful breathing, difficult breathing. So dysrhythmia is like bad rhythm. So it's either a bad rhythm or arrhythmia is no rhythm when they have one. And there was one actually at the beginning. Where is it? Here's abnormal heart rate. So this one's pretty common. You'll hear this sometimes. This can be a normal finding. So notice how the heart rate speeds way up when they breathe in, but it slows down when they breathe out. Mine does that too. So again, this can be, it can mean nothing. It could mean something, but usually means nothing. I have this. So, and then down here is what we call atrial fibrillation. And so fibrillation is the next word on here. It says rapid, random, ineffectual, and irregular heart contractions. So what happens when fibrillation, when your heart goes into fibrillation is instead of like your normal heart beats, right, it pumps, one part of it, you've got atrial fibrillation and the atria just start quivering in place like this. It's like they have a short or something. So instead of pumping and pushing blood onto the ventricles, they just sit there and shake. Yes.
Is that why you have the defibrillator?
That's exactly right. So an atrial fibrillation though is not like it's not, it is life threatening if it goes on long enough or if something happens, but it's not like you're going to have a heart attack right that second. I mean, people take medicine for atrial fibrillation all the time. This is it's kind of like, there's times where it's not, you don't hear it at all. But this can, you know, there's a few things. When I have a family member who has this, and so he takes medicine every day for it. But then every once in a while, if he gets sick or really stressed or gets a virus or something like that, it'll kick back in, and his atrial fibrillation will start again. Or AFib is a abbreviation you hear it called a lot. And so he'll take his medicine, and he'll take that medicine and try to get it to flip back over into a normal rhythm. And then if that doesn't work in a couple hours, then they go to the emergency room and they have to cardioverter him. So sometimes they can do it with medications, just give him the medication and try to kind of like restarts or like makes it, it's not kicks it back into normal gear. Or sometimes they have to do, you know, like an external, they might have to do an external version of some sort. So that's an atrial fibrillation. Now, ventricular fibrillation is a different story. Think about it. Your ventricles, they start quivering. What are some problems that can occur?
Or your blood through?
Right. Your ventricles pump blood to your body and to your lungs. So if they start quivering and they don't have an effectual pump, where's that blood going?
Nowhere.
Nowhere. It's just like keeps on going through the ventricles, right? So if that's the case, then what happens? Yeah, within minutes. So that is really a massive heart attack. Usually people will go in, it's not that their heart just stops completely, but they'll go into ventricular fibrillation, which makes sense. You think that, okay, if you think about part of the ventricle dying, just a part of it, there's still part of it, right, that may still have good enough blood flow or oxygen to it to keep functioning, but it can't really function without half of it. So it's just like, I don't know what to do, you know. So it does that, and that is what you use an AED for. So an automatic external defibrillator. There's one in the cafeteria, there's one in the gym. That's what that's for, automatic external defibrillation. specifically ventricular fibrillation. So it literally, it sends a shock through their heart to kind of restart it on a normal rhythm. That's the goal of an AED. And that's not, you cannot stay in ventricular fibrillation for more than a few minutes. Your brain doesn't get oxygen, your lungs aren't getting blood flow, so it's just, won't work. So that's really a heart attack. A lot of times ends up in ventricular fibrillation. Okay, the last ones are abbreviations. So CAD is coronary artery disease. We'll talk about that in a few minutes. CABG, CABG, is coronary artery bypass graft. We're going to look at that in a minute too. So I'll explain that. A DVT, deep vein thrombosis. What's a thrombosis? Blood clot. So a deep vein thrombosis typically is in your leg, like in your calf. Never had a family member with a blood clot in their calf. That's a DVT. That's a major problem because one, obviously the leg's not getting blood flow like it needs to, but two, that can dislodge and go up to the brain, cause a stroke, or go into the lungs and cause what's called a pulmonary embolism. So that can cause lots of issues. AV is atrioventricular. We've talked about that. It just means atrium and ventricle, like the AV nodes or AV valves. There's an AV node in the heart. We won't go into that much detail, but. And then HGB is hemoglobin, which we already talked about. Carries oxygen. So those are your PayPal terms. Oh, I need to eat. I don't know. Maybe that was too much. One thing, tomorrow is the circulation quiz. So don't forget about that. It's on your PowerPoint on like maybe slide 5 or 6 or something. I will give you, it will start with Vena Cava, so I will give you that one so you'll know where to start, and then it'll just have blanks, but there is a word bank, so make sure you study that. So, yeah, you have that tomorrow, and then you're going to have time to work on your project. Okay, so make sure you're ready to do that. Work on your project tomorrow. And make sure you use your time wisely. I'm going to give you time to work on your project in here, then work on your project in here. Okay? Promise you, I promise this a lot, but I promise it's not, this is not a project you want to wait until the last minute for. You will be sad. It will be a sad day for you if you do that. So, okay, let's work on your PowerPoint then. I have that we were at.
Yeah, I'm not sure where all four is.
I have it written down.
It's bird, I don't have that. I wasn't here. I don't have the phone because I don't know where I put it. I lost mine.
All right. Lost yours with all those notes on it?
Yeah. It's probably at my house with all my graded work.
Oh. I was gonna say water.
Mercedes.
Do you have these on the front?
Okay. I had that we were at right here. We talked about the flow of blood. And then I think we're at the normal heart. I'm going to, can y'all stay alive? Can y'all stay awake if I turn off the light? Okay, so this is a normal heart. You can see there's a little bit of fatty tissue on it, that's normal. Okay, All that yellow is just fatty tissue, which it needs, right? It needs insulation. Some of that's normal. Okay. And then you can see the blood vessels around the edge of it. I mean, around the outside of it. These right here. All right, this is a heart with cardiomyopathy, which is just heart disease. Okay, but notice it's oversized. I think they said this on John Q the other day. Right, it's really large. This is the aorta, probably right here. Really a lot of fatty tissue on it. Well, this person is dead. Otherwise, I wouldn't have this picture. So.
How do you know they didn't give them a new heart? They keep your old heart.
Well, they could have. Yeah, that's true. That's good thinking.
Oh, man.
All right, so these are pinpoint hemorrhages. They're called petechiae. On the outside of the heart. So due to a low platelet count. What do platelets do?
They
what? No, not platelets. Those are red blood cells. What's the other word for platelets? Starts with a T. It's a cell. Clotting cells. Thrombocytes. So thrombocytes are platelets. Those are your clotting cells. So if you have a low platelet count or a low thrombocyte count, then it's just really easy to bleed. That's what's happened here. All their capillaries are like bleeding, like kind of leaking out, if you will. Yeah, not a good thing.
What's around the heart?
Yeah. What do you mean? All this tissue around it?
Yeah. Oh,
This is still in someone's body.
oh, well, that person's dead now.
Maybe.
Maybe not.
All right, coronary artery disease. So coronary we know means heart. So heart artery disease. It's all these arteries around the heart, okay, that are diseased. So usually this is caused by atherosclerosis, which is it was a payday term last week.
The plaque stuff.
Plaque, yes, fatty plaque, remember that now? And sclerosis is hardening, right? So that's what we see, coronary artery disease, that causes it usually. Narrowing of the arteries that supply blood because it's got all that fatty plaque on it, right? Atherosclerosis. And then risk factors for this are diabetes. So if you have diabetes, you're at a higher risk for this. DM is diabetes mellitus. High cholesterol, hypertension. You might know what hypertension is?
Oh, your blood pressure is like.
Yes, high blood pressure. Hyper, remember, is excessive or above, so high blood pressure. Hypotension then would be low blood pressure. Good. Obviously this is going to cause high blood pressure, right? If normally your heart pumps, gives enough pressure to fill up blood vessels that are normal size, if you narrow those blood vessels and make them smaller, there's going to be a lot more pressure behind it. So yeah, it's definitely going to increase your pressure. And it makes it worse. Obesity, smoking, and then heredity. So your family has a history of CAD, you have a risk for that. You're at risk for that too. Signs and symptoms are angina, which is chest pain, just like chest pain, and then SOB is shortness of breath. Shortness of breath is the other.
I knew that one.
So makes sense, right? Short of breath because they're not getting enough oxygen because those blood vessels are so tiny. And then the things that they use to diagnose CAD is an EKG, which is a
Electrocardiogram.
good electrocardiogram, or an angiogram, which would be what? Blood vessel. So picture record of the blood vessel. So let me show you this. I'll show you an angiogram. All right. This is pretty cool. So this is this is in a surgery. see.
Left ventricular pressure,
I'm checking the
retrograde here with the
pressure.
pigtail catheter.
So this is an angiogram. They're also going to do a stent placement. You've ever had a family who's had a cardiac cath done? I've heard that word before, cardiac catheter. That's what they've done here. So what they do is they have this, they use like this really big needle, and then they use a catheter that goes around it, and they actually insert that into your femoral artery, which is at the groin. So they put that, they insert that in. It's got a long catheter. You know how we looked at that IV catheter is really short. This one's long, and they put that through.
No, I was.
And anyways, and it goes all the way from the femoral artery up to through the aorta, back around to the heart. So that's how they get in, and then they'll look. So what they're doing right here, and they can send a camera into a lot of times through that. They can do stents that way, and then they'll show you. It's pretty cool.
All right, we now have a catheter inside the heart, inside the left ventricle. Inject.
So there's the catheter. Yeah. So he's injecting dye.
We're going.
Real quick, he's injecting dye into the left ventricle. Notice though, this is the aorta right here. Look how large the aorta is. Okay, it's like almost as wide as the ventricle itself.
To look at the arteries that supply blood to the heart, the coronary arteries, using catheters that will select the coronary arteries. We're going to start with the left.
Around the heart.
And so far, so good.
Okay.
All right. We're taking a picture of the left coronary artery.
So if you look, they've taken this catheter, inserted it in through the coronary artery. So they've gone back through the aorta, and now they've gone out of, remember I showed you guys the other day, those coronary arteries start kind of at the base of the aorta. So they have taken that catheter and put it through those into these blood vessels that sit around the heart. And so then they inject this dye, and this is what it does. And you can tell, because this is kind of shaped like the heart, that's because those blood vessels are wrapped around it.
Left circumflex artery, the left anterior descending.
See it? You can see the whole
coronary artery
pretty much.
Supplies blood to the top and the front of the heart. And the left circumflex.
Another one. Looks good.
Supplies blood to the posterior portion of the heart and the back of the heart. And now we're going to look at the right coronary artery. Supplies blood to the bottom part of the heart.
Squeeze.
So the right coronary artery is
okay, so look at this one. So he's
totally
injected that,
included.
but look, it will only go this far. This should do the same thing. It should be circled up around the heart too. Everybody see that? How it stops right here? So that means this one is occluded.
He's been having symptoms intermittently for the last couple of days. So we're going to open up the right coronary artery. He's had, looks like a little bit of damage to the bottom part of the heart, which you see in this picture here. And that's the part of the heart that's supplied by the right coronary artery.
That's my guess.
So this gentleman has an occluded right coronary artery, which is likely recent. His last prolonged episode of chest discomfort was today. So he's wall of the heart, which suggests that he's in the process of having what we call myocardial infarction or heart attack. The left system looks fine. So we're going to go
that
ahead.
one area has died because it's not getting blood flow. He's saying he's in the process like he's having a heart attack. It's like an ongoing kind of thing. A heart attack's not necessarily just like a sudden thing. You have it for a second and then it's done. It can be ongoing, like his chest discomfort. I think they said earlier, I heard it in another class for a couple days. Worse, they just had an episode today, so it's still going on.
And open up the right coronary artery.
So this is pretty cool.
So what we're first going to do is we're going to access the right coronary artery with a special type of a catheter called a guiding catheter. Place a wire across the blockage, and then pass a catheter that will remove clot from the vessel. In patients who have acute coronary syndromes or acute heart attacks, these are from clot and plaque. And so to make the artery ready for the stent, we need to withdraw some of the clot. So we're going to do that with a specialized catheter first. Right now we're placing a guide catheter into the right coronary artery, which is occluded. So on the bottom screen, we're going to show the vessel as it is now that I could use for a road map. and then we're going to improve that vessel to normal. So the first thing we need to do before we place equipment into the artery is place a wire, manipulate a wire across the blockage in order to place all of our equipment.
You can see right now they're putting this little wire through the blockage to get to the other side.
So we have a wire going into the artery here.
That kind of
Okay, so we've gotten the wire across the blockage.
So
What we're going to do is place this catheter beyond the blockage if possible, and then through the catheter with negative suction, attempt to remove the clot that caused this artery to block suddenly this morning. And then we'll take a look at the artery and see how it looks once we do all that. We're going to take a quick shot after the export catheter has been passed.
So,
Go ahead. All right, so the artery's open. It just looks small. Okay, now that we've restored flow in the vessel, we're going to use a balloon to open up the artery and use some
got enough of it out.
nitroglycerin
More
to
blood flow.
get rid of some of the spasm. So now with the balloon, we opened up the critical blockage, but we still see a lot of thrombus in the vessel past the blockage. So we're going to put what's called the export catheter back down
Try to draw it some
and
more.
withdraw a little bit more clot from there. So after one pass with the export catheter and one inflation with the balloon, the artery's open and we're able to see beyond the blockage now and see what work needs to be done to restore blood flow through the artery. So now we have the export catheter way down the artery here, way below the blockage itself, and we're withdrawing clot as we pull the catheter back through the artery. We're now withdrawing the export catheter from the distal part or the end of the artery back through the blockage and back into the catheter so we can eradicate the clot all the way through the vessel. Look how big that artery is. The bottom picture is a picture of the artery before we started, and the top picture is after several passes to remove clot throughout the vessel, and then an angioplasty or a balloon inflation
So it
in
looks
the
like
beginning of the artery.
yeah, they're probably gonna have to put a stent in right here. See how this is really narrowed? So they got it all fixed. They got it flowing again. It's not stopped up here anymore. But they're gonna have to do something to fix that. So they'll probably put a stent. I'll show you guys a stent real quick.
Not part of the heart already done, though.
Do what? Yeah, but it can grow some new cells and hopefully at least it may not come back to full restoration, but it should be able to be better at least. Real quick. Okay, let me show you guys. Okay, let's see this one. Anyway, okay, let me show you guys these. Okay, so a few things here. One, this first one is an angioplasty. So it says a balloon angioplasty. What would angioplasty mean? Right, a repair of the blood vessel. So they have taken this balloon, they've gone in and they just kind of like opened up that, remember it's really hard on that fatty plaque is really hard, so they opened it up. Second one here is a coronary atherectomy, which would be what? Athero is plaque and ectomy is removal. So they actually go in and like scrape some of that out and try to get it out. And then this third one is an actual stent. So they go in with the balloon and then the stent, they open it up, right? And then they leave that part in there. They leave the stent part, almost like a Chinese finger trap or something. Right? So they leave that in there to hold it open. And what that does then is that stent will stay in there and hold it open. So hopefully it doesn't get clogged up again. So anyway, so that's what a stent does. What are some problems you think might could occur with the stent, or what are some risks do you think? Think about what it looked like. Potentially, I mean, they're pretty tough. They're not like, you know, it's not going to be something flimsy that they're putting in there. I know I said net, but it's not really a net. It's like it would be like a structure, like plastic. Something. Do what? What do you say? What about it? Okay, it looked like a net. So what do you think might be some issues with blood flowing through it? Yeah, right. It might catch blood cells and clot up. So a lot of times people have to take blood thinners, some kind of blood thinning medicine, to help with that, to help prevent clotting there. So that's an angiogram. Really is just the picture itself that they were taking. Right, that angiogram was them looking at those pictures of how it was flowing, and the rest of it was really treatment. They were doing it. They were, you know, opening it up and things like that. So the treatment, medication, nitroglycerins for chest pain, cholesterol and blood pressure meds to control it, stent placement like we just looked at, and then for if it's severe, then a lot of times it will require a CABG, coronary artery bypass graft. And I guess we'll start here. We'll start here Thursday.